Hello, YouTube world. It's Miss Patty with For Your CNA, and today is the 13th of January, and I'm here for our normal weekly Thursday at 3 live question and answer session where I answer questions from you about CNA training, testing, or even information about the CNA workplaces that you might find interesting to work in. So while we wait for everybody to join, it takes just a few minutes for people to trickle in. Hello, Marley. Hi, Ramses. Thank you so much for joining. So as people are joining, hi, Shirley. I want to talk to you today. As you guys know, I give a little mini lecture as we're waiting for people to come in. And today, I want to talk about a testing concept. Hi, Mommy Lee. Thanks for coming. I want to talk to you guys about the skills portion of the test. And this causes people a lot of anxiety, you know, when it comes to the test itself. Hi, Sandra. Thanks for joining us. So one of the tips that I give my students, because you guys know I still teach classroom. Hola, Karen. Hi, Nida or Nita. Hi. Happy to see you too. So in my class, usually about the halfway point, people start to get really focused on the test because that's about the time that we're registering for the test and we're getting ready to take it and we're talking about what to, expect on the test. So stress levels start to go up, and I see it in my students. One of the things that I tell my students, and this makes a lot of difference, is you guys as CNA students are focusing on the steps. Hi, Jennifer. Hi, Kiara. Hi, Gloria. Hi, Shay. And hi, Saskian. Nice to see you guys. And I'll get to your questions in just a second. Thank you, Gloria. I appreciate that. It needs to be done desperately. All my gray is showing. Look at that. With COVID, man, it's so hard to get all that personal care stuff done. So one of the things that I tell my students is, right, when you're a student, you've got your book and you're going through the skills. So let me get a skill here. So this is one that Jennifer was just talking about, so we'll actually talk about this one. So you're focused on the skills, you've got the book, and you're following along step by step, you're doing all the steps, and this is where 100% of your focus is, because you are concerned about failing. And unfortunately, when you do that, what you've done is make the test all about you. And in reality, the test is not about you, and it never will be. The test has nothing to do with you. The test has everything to do with the patient that you're doing this skill on. So if you're focusing on the steps and you're not paying attention to the patient, there's a good chance that you might fail because you're trying to think about all the things that need to be done, all the steps, and you've missed the fact that the patient is not swallowing their food before you give them another bite, or the patient looks uncomfortable, or the patient isn't sitting up straight. If you focus on the patient 100%, 100%, if it's all about the patient, not the process, you will do much better on the state exam, because when the evaluators are grading this, their checklist that they're following to check stuff off, every single one of those checkpoints is about the patient. So if you're not focusing on the patient, chances are you're not paying attention to the right things. Now, all of these steps are designed to, make sure the patient is safe and they're in the middle of the bed, or you're not feeding them too quickly, or you've offered them a hand wipe. I mean, all the steps go over everything, but it really does come down to your focus. If you're focused on the process, you're not paying attention to the patient. So if you can make that mindset shift, if you can shift from you to the patient, and if you're focusing completely on the patient during the test, you'll start to realize that, oh my gosh, that patient doesn't look comfortable, or that patient's not in the middle of the bed, or, oh, the patient's uncovered and they probably shouldn't be exposed, or the patient doesn't look like they understand what I'm saying. If you're focusing on the patient, which is what the evaluators are focused on, you will get a much better outcome on the state exam. So the way that I explain this to my students is make sure that your focus is in the right place. Focus on the patient, not the process. So if you can kind of make that shift in your mind and make sure that you're focusing on the patient. Do they look comfortable? Do they look safe? Are they in the middle of the bed? Are they exposed? Did you explain the steps to the patient so they know what you're about to do? It's not enough to just go in there, read the care plan, and do exactly what's on the care plan. That patient has to know what you're doing with their body. So explanations really count big on the state exam, but they count big in real life too. If you focus on the patient for the exam, that means that you'll focus on the patient when you're out there working. And as a patient, I would really like you to focus on me, right? Because otherwise, if you come in and I don't know why you're undressing me, I may react, to the fact that somebody's in there that I don't know, that is a complete stranger to me, and is moving my body or taking my clothes off or repositioning me, and I don't know why. So understanding that it's all about the patient really goes way beyond the test itself, because our patients really do need our focus. It doesn't need to be on the steps. It needs to be on the patient. So I hope that helps you guys that are getting ready to test. It really is good advice for the test, but more importantly, those of you who are already certified, make sure that you're still focusing on the patient every single day, every patient encounter, because that's what they need, right? So let's get to your questions here. So Jennifer asks, in my class, they always said when dressing, it's always put on weak, take off strong. I don't get why it matters. That's a really good question, Jennifer. So the way that I explain it in my class is USA first. So undress, strong, arm first. USA. Undress, strong, arm first. And we do that when a patient has weak or affected mobility upper extremities. So if we have an arm that either has been paralyzed from a stroke or maybe has had surgery to repair a rotator cuff or something like that, the way that you dress and undress the patient does matter. So if we've got a patient that has that weak extremity, we tell the family or the patient, go out and get clothing that buttons or snaps up the front. So we don't want to dress from top to bottom like we normally do. Like right now, I'm wearing a pull-over shirt. I pulled it over my head, but both of my arms work fine, so I'm able to extend my arms out to get my arms in the sleeves of the shirt. But if I have immobility on one side, if one of my arms does not extend well, or it's paralyzed, then dressing top to bottom doesn't work very well. It's much easier to dress side to side. So if we have somebody who has a shirt that we're going to take off and then put on, so we're going to change them, when you undress the strong arm first, you make it do all the work. So we unbutton or unzip or unfasten, whatever we have to do, and then that stronger arm has to do all the work, pull in and get out of the sleeve. And then the garment just slides right off the weak arm, no movement required, no motion necessary. So then we're going to dress that weak arm, so the new garment just slides right up the arm, no movement necessary, and the stronger arm again will do all the work. So the way that we remember this is undress strong arm first, dress weak arm first. and it does matter. And that's a very big graded checkpoint on the state exam. And again, it's all about the patient, because we don't want to cause them pain or injury when they're getting dressed. So that's why we have that process. So I hope that helps you. Shay says, thank you for your videos. I passed my exam on December 30th. Congratulations, Shay. That's awesome news. We're super, super happy and excited for you. Welcome to healthcare. Saskian says, hi. Let's see here. Queen, hola. Cool Motion says, hi. Cutie, okay, now, Cutie, I'm just going to call you Cutie because I'm not real sure how to pronounce your name. And it says, I'm Linda. This is my first time joining you live. I'm taking my state board on January 25th. And I actually have you on my list to talk about today, so that's really funny. Because you had asked on a comment on one of my videos if they're still doing skills testing in Florida with COVID. And the answer is yes, they are. They only suspended testing for a very short time. And that's because we desperately need caregivers. Right now, we've got a record number of patients in the hospital, and we have a record number of staff that are out with COVID. So we absolutely need caregivers. So yes, testing is continuing. And for the most part, most skills are being tested. There are a few exceptions to that. And I'm going to leave that up. I'm not going to really talk about those because the skills can change all the time as far as the accommodations. But right now you are required to wear a mask throughout the entire testing process. So any skills that would require that the person playing the patient doesn't have a mask on, so think feeding, mouth care, that type of thing, they can't test on those right now because you do have to remain masked throughout the entire skills test, okay? So I hope that helps. And Kimberly, hello, good day. Denise said hello. Paulette says, hi, how are you doing? I'm doing great. If you get a transfer to New York, do you have to come back to Florida to renew your certificate, or can you just go online and renew it? That is a fantastic question. Renewals can be done online. You do not have to be present in the state of Florida to renew. So, for instance, I just saw on Facebook, I'm plugged into a couple CNA groups out there, and there's several travel agencies that posted openings. And the Sacramento area, I think out in California, is offering $35 an hour for CNAs. Oklahoma is signaling a critical need, so they're offering really big bonuses. So there's a lot of opportunity nationwide right now. So that means that if you're going to go to another state, you have to be certified in that state to work. And in most cases, you just contact the state, say, I'm a Florida CNA, I want to be a New York CNA, and you have to go through their background check, send them some money, and then they certify you. That doesn't mean that you're giving up your certification in your original state. You still have that. You're gaining an additional one. So now you have to figure out whether you want, when it comes time to renew, whether you want to renew, and you've got to make sure that you meet the criteria for renewal. So here in Florida, our criteria for renewal is that you've worked at least once as a CNA for pay, and you've completed your in-service hours, which can be done online. I got a whole video on this on my website. If you go to foryourcna.com, under after certification, I have a whole section there on continuing education, how to renew, and all of that. So you have to make sure that you're meeting the criteria for the states that you want to renew. There are other states out there that you have to work currently in a nursing home in that state to renew. So you have to know what the renewal requirements are in the states that you're planning on renewing in. But most of them, the renewal is simply online. You just go online, pay your fee, check the boxes to make sure that you've done the renewal, and you've renewed. Some states, actually, the employer has to do the renewal for you, because that's how they make sure that you're still working in long-term care in that state, which is what they need to meet their renewal. So every state is a little bit different. So let's see here. Lauren says, how do you deal with nurses being annoyed every time you tell them something? Man, I really wish that I could say that all the nurses out there were good nurses. But, we have bad cashiers at Walmart. We've got bad servers at Chili's. And we got bad nurses, in a clinical setting. I really wish I could say that, everybody was in it for the right reason. But understand that the nurses are responsible for the patients. They're legally liable. License means liable. CNAs are certified. It's a little bit different when it comes to liability. So the nurses are liable. That's why they need the information, because they are liable for what's happening to that patient. So if you go to the nurse and you say, hey, Mr. McGillicuddy has a cut on his foot, and the nurse doesn't do anything about it, she's the one that's liable for it. But at the end of the day, that really doesn't mean anything when Mr. McGillicuddy isn't getting the care that he needs, right? He's got a cut on his foot. Somebody needs to be aware of that. Somebody needs to be addressing it. And if the nurse isn't doing it, I would probably bring it up to, maybe another nurse on another shift, right? So remember that nurses don't work 24 hours a day. We're split up into either 2 shifts or 3 shifts a day, depending on how your facility is structured. So during shift change, you may want to mention it to the nurse that's coming on. If nothing is being done and you know that there's an issue that's not being addressed, you can escalate it up your chain of command as well. Nurses have supervisors. So there's floor supervisors, there's an assistant DON, and there's a DON. Now you need to know your chain of command for wherever it is that you are working, and you can escalate the concerns up the chain of command if you think it's having a detrimental effect on the patient. But you kind of have to be careful with that, because that can create a hostile work environment. And I really, really wish that nurses were a little more conscientious. Unfortunately, this doesn't excuse it, but a lot of nurses are overworked. They have way too many patients. They have no time off because they're getting called in to cover shifts. And, they may not be there for the right they may not have that right mindset, or heart set is what I call it. So there's no real easy way to deal with this, unfortunately. Just do your job. That's the biggest thing I can tell you, is don't stop reporting because a nurse seems annoyed. That's their problem, not yours. You keep reporting. That's what you are supposed to do. And if it's something that you think might be detrimental to the patient, make sure you're passing it on to somebody else, because I would hate to see a patient suffer a catastrophic problem because nothing was being done, nothing was being reported. And I'll give you a great example of this. This was something that was reported to me by one of my students whose husband had a catastrophic illness that eventually resulted in a stroke, and he's a very, very, very young man. And she kept reporting this symptom to the nurse, and the nurse didn't do anything about it, and he ended up having a life-threatening bacterial infection in his brain, and ended up having to have multiple surgeries because the nurse didn't listen. And that's tragic. That's going to affect this young man for the rest of his life. And it really is very tragic that the nurse just decided that it wasn't important enough to address. So, if you feel that this is something that is important, make sure that you're reporting it to somebody other than just your nurse. Okay, I hope that helps you. I would absolutely love to have a motivation speech to nurses as well. But right now, we're starting with CNAs, and hopefully some of you will go on for nursing and you'll take these lessons with you so that we can change healthcare maybe from the bottom up. So for some of you, go to school for nursing and be those really good nurses, okay? Trina says, hi, Miss Patty. What's the difference between an MA and a CNA? A plastic surgeon's office I was in yesterday as a client said they were hiring for an MA, but I'm not sure what the difference is. Well, Trina, I've actually gone over this a couple of times in some of my lives. It's a very, very common question. But the answer, believe it or not, is in the name. So CNA is Certified Nursing Assistant. We work with nurses, and we get our information and our tasks from nurses. We report back to nurses. We are nursing assistants. So anywhere where a nurse is working, you can find a CNA. Now, MA stands for medical assistant. So they work a little bit differently. They assist medical professionals. So we think of medical as this like all-encompassing umbrella, but it really is two camps. There's medical, which are doctors and physicians assistants and that type of thing, and then you've got nursing. So medical focuses on the disease, the problem. Nursing is supposed to focus on the patient, and in a perfect world, those two things come together and we're treating the problem and the patient at the same time, and we have great outcomes. So in a perfect world, that's how it's supposed to work. It doesn't always work that way. So MAs are going to work with medical professionals. So these are doctors, physicians, assistants, that type of thing. And they're mostly found in doctor office settings. That's where you'll find MAs. Sometimes you'll find them in medical records and things like that, but most of the time they're going to work with doctors. So nursing assistants work with nurses, medical assistants work with doctors, but some of the tasks overlap. Like both people, both MAs and CNAs can do vital signs. Both of you can get health history. Both of you can get a list of medications from the patients, find out why they're there. So a lot of doctors' offices can use CNAs in that setting. Now, CNAs have additional tasks that they do outside of an office, like you know how to give a bed bath, you know how to help care for catheters, those types of things, where you wouldn't be doing that in a doctor's office setting. Medical assistants also have some additional skills, things like filing, appointment setting, and maybe even doing EKGs and drawing blood. Now, those are all skills that can be taught to you in any setting. So as a CNA, you can learn how to how to obtain an EKG in a hospital. You can learn how to obtain an EKG in a doctor's office. Those are delegatable skills. You need a little extra training. Training does not have to be in a classroom. It can be on-the-job training. So CNAs, in a lot of cases, can work in a medical assistant role. Interestingly enough, though, medical assistants cannot work in a CNA role, so it's not truly compatible. So it's a little bit funny the way that works, but there is a difference. Now, it depends on the state that you're in, because different states have different laws. It also depends on who the physician is, because some doctors prefer to have medical assistants, those that are already certified as a medical assistant working in that role. Other doctors are perfectly happy to hire a CNA and train them with the other tasks that they need to know. It depends on the state that you're in and where you are potentially going to work. Okay, so I hope that helps you, Trina. I know it's a very complex subject. There's a lot of legalities in the back end of this because not all states are equal. Beauty by Nicole says, will they still test on bathing and denture care? Yes, bathing, yes. Bathing is still a tested skill. Denture care, they can have you do the denture part of denture care. But as of right now, I do believe that denture care is suspended due to COVID, but don't quote me on that. I'm not 100% sure because these standards are changing. And the other issue is it's not uniform across all states. So what I tell my students is prepare as if you might get mouth care or feeding or denture care. Prepare as if it's a skill you're going to get. So you need to know how to do it. You need to practice it. And if you get it, you're ready. If you don't get it, that's okay, because the patient you're going to take care of next week will need it. So make sure you know it. Okay, Kanisha says, I hope you're having a good day. Thank you, Kanisha. I'm having a fantastic day. I get to hang out with you guys. Linda says, which vital signs are being performed for the state test? Well, Linda, in Florida, we have pulse, respirations for vital signs. We also have feeding and emptying the drainage bag as documentation skills. So in Florida, you will get, or with Prometric testing, you will get one documentation skill. So pulse, respirations, feeding, or drainage bag. So the vital signs that they're doing for testing purposes is pulse and respirations. But that doesn't mean you don't need to know blood pressure. Make sure that you still have a good understanding. You can't rely on the machine, because if the machine gives you an abnormal reading, you've got to be able to double check it the old-fashioned way. Because if I get an abnormal blood pressure, let's say my machine gives me 160/92. I don't know whether that really is the patient's blood pressure. That might be the machine that got knocked over and now it's out of calibration, or the battery is dying and it doesn't have as much juice as it needs. There's a lot of things that can affect medical equipment. So if we get an abnormal reading, we always have to double check it manually. So make sure you know how to take a manual blood pressure. Just because you're not being tested on it for the test doesn't mean that you don't need to know how to do it and be competent in it. Because it might be my blood pressure you're taking one day, and I want to make sure I'm getting the right medication and the right dosage. Okay? Blue, hey Blue. Seattle area staffing agencies are offering $23 an hour for home care aides and $28 an hour for CNAs. Wow, that's amazing. Let's see here. Blue says, vitals here in Washington State are manual blood pressure, temperature, weight, height, pulse, oxygen sat. Yeah, we don't have all of those on our test right now. Let's see here. Hi, Marlene. Thanks for coming. Jennifer says, so are nurses liable for everything the CNA does? Yes, absolutely. And that's why it's so important that when as the nurse, right, as the RN, I have to go in and do an assessment on my patient every single shift, head to toe. I've got to know everything that's wrong with them and what we're going to do about all of it. But I also have to think about things with that patient that are like what we call ADLs, activities of daily living. So toileting, eating, grooming, dressing, mobility, socialization, all of those things. Because I know that sometime during this shift, my patient's going to have to toilet. I mean, there's just no way around it. So I got to know how we're going to accomplish that. I mean, are they going to go to the bathroom by themselves or with help? Do they need a bedside commode? Are they using a bedpan? Do they have a catheter? Are they incontinent? I have to go through all of that myself. So when I develop this plan, this care plan, I'm going to relay it on to the people that are helping me. Now, I can certainly toilet the patient. That's not a problem. I can feed the patient. I can help the patient with mouth care. I can change the patient's bedding. But the problem is, if I'm doing all of that, who's going to be doing the assessments on the rest of the patients, right? That's only something an RN can do. So CNAs do routine tasks on stable patients to free the nurses up to do higher level tasks. That's why we work as a team. So I do the assessment, I create a care plan, and you follow that plan exactly and report anything that you see, hear, smell, or feel to me. And that way we all stay on the same page, because I am the one ultimately that's liable for that patient, everything that happens to them. And that means that everything you do, I'm liable for as well. Now, there are some exceptions to that. Okay, so as long as you're following the care plan, CNAs are not liable. If you're making up your own rules as you go, if you're doing things, if the care plan says the patient needs to lay flat on their bed for 6 hours because they just had a lumbar puncture, and you decide, no, I'm going to get you up, let's get you in the chair because I got things to do, and you get the patient up, well, you're not following the care plan. I'm not liable. Now you are, because that was a decision you made. So that's why it's so important that CNAs understand their role. CNAs follow the care plan, period. End of discussion. You don't make anything up as you go, because when you do that, I am now no longer liable for what you're doing. You are. And you're actually acting as a nurse, and that can legally come back to bite you because you don't have that training or that credential to do so. So I hope that helps you, Jennifer. That's like a really important foundation that everybody needs to understand. So Paulette says, thanks very much. I have my question answered. I love watching your live. Oh, thank you. I love doing this. Kimberly says, I'm a caregiver, and all the videos you have done in the past and present have helped me do my jobs much better. Oh, thank you. I'm so sorry to hear about your mother-in-law passing. I do. I understand. That's just, I send you my sympathy. I'm so sorry for your loss. But I'm glad that you were able to help her effectively. Marlene says, I want you to help me to have an appointment with Prometric for my test. Marlene, if you go onto my website, foryourcna.com, under testing, I have test registration instructions. I also have Prometric's phone number there, so if you've registered and you're not getting any information, then you can contact them directly. I can't help you register. That's out of my scope of practice. Blue says, keep in mind with COVID-19 going on, everyone is stressed out and on edge. Yes, Blue, you're absolutely right. This is probably in my lifetime, this is the most challenging time to be in healthcare, without a doubt. And, unfortunately, I would like to think in a perfect world we don't let politics influence healthcare, but in our current society it does. And it really is, I see it tearing the fabric of healthcare apart, on top of just being overwhelmed with the amount of patients and shifts and a lack of supplies and a lack of direction. It is the most challenging time to be in healthcare, for sure. And yeah, your nurses are going to be on edge. I really wish that I could say otherwise, but yeah, they will. As Nurse Patty said, always document everything you do, because if it's not documented, it's not done. Absolutely, Shay. Let's see here. Antonia says, hi, how are you? I am fantastic today. I'm actually feeling better, so that's good. Ashlyn says, hello, new to your channel. Well, thank you. And you're from Idaho, taking your skills and written test at the end of January. Was a CNA about 5 years until I had my kids, and it's been 10 years since you worked at one. Well, welcome back to the industry. We always like to see people return. I always say that caregiving is a work of heart, and if you have the heart for it, you'll never venture far from it. You may leave healthcare, but you're always drawn back because of that heart. So welcome back, and I'm glad that you're finding our channel helpful. Thank you. Fatau says, hi, Miss Patty. How are you doing? I am fantastic today. Merlan says, hi. Beauty by Nicole says, how about in an ALF? And you have memory care patients. Okay, so Nicole, memory care patients or dementia patients, anybody who has a cognitive impairment. Cognitive impairment just means that their brain doesn't work quite right. Either they can't understand what you're saying, or they can't express themselves so that you understand what they're saying, or they don't have the capacity to rationalize and keep themselves safe and make decisions. So cognitive impairment can cover a wide range of things. When you're working with cognitive impairment patients, there are some special rules that we have to put into place. And I'll actually do a whole lesson on this in a couple of weeks, communicating with cognitively impaired individuals. But this situation, it's more important than ever that you follow the care plan. And we're going to limit the choices that we give, but we're going to communicate like our lives depend on it. And that means that every patient that you communicate with, you're probably going to have to communicate a little bit differently because it's a special group of people. But we still follow the care plan 100%. And it's probably more important with cognitive impairment patients that we follow the care plan and do not deviate from it, because there's something to repetition, schedules, understanding, doing the same thing every day in the same order, in the same way, because then you don't have to employ coping mechanisms. And we'll talk about that in a couple weeks. I actually have that on my list as a lecture to give, and it's 3 or 4 weeks. So stay tuned, okay? And Blue says, if injured on the job, task not in care plan, workers' comp doesn't have to pay for the job injuries. That's right, Blue, absolutely. That care plan is there to protect you as well as tell you what to do with each patient. So very good. Marlene says, thank you very much. Mona says, Happy New Year. Happy New Year to you guys, too. I hope this year brings you guys peace and prosperity, and I just really hope that we have a good year. I think we all deserve a good year, right? Ashlyn says, thank you. What a time to return, but I love it. There's such a need. Absolutely. Absolutely. Lena says, what if I'm given a skill and I have a back issue? How do I let them know I have this problem? Great question. Okay, so when you go in for the test and they check you in, you got to take 2 forms of ID, one with a picture, one with a signature, so like your driver's license and social security card. And once they check you in, they're going to ask you, do you have any physical limitations that would keep you from performing a skill or being a patient for a skill? And that's your time to speak up. So if you just had some dental work done, make sure they know that. If you've got athlete's foot going on, make sure they know that. If you have food allergies, make sure they know that. And if you have a back injury, you need to make sure they know that as well. However, okay, and this is going to be my caveat to this. When you're testing, there is no accommodation for back injuries. So if you get transfer from bed to wheelchair, there is no accommodation that says, okay, this CNA candidate cannot perform this skill because they have a back injury. There's nothing. You have to be able to physically perform all of the skills. Unless you have some sort of a ADA accommodation, so this would be the Americans with Disabilities Act accommodation, and those are really, really hard to get, especially for back injuries. You have to be prepared to perform all of the skills. Now, wherever you go to work, you can certainly let them know about your limitations, and try to find a job that, that has tasks that meet your specific limitations. But as far as the test goes, you need to let them know about it, but they can't really change the skills to accommodate it. I hope that makes sense to you. Because, as a CNA, we have to be able to do all the skills at any time, and we can't tell a patient, I'm so sorry, I can't help you because I'm injured. The patient has an expectation that you're going to be able to help them with whatever they need help with. That's why you're the CNA and they're the patient. So it does complicate things a little bit, certainly. Make sure the evaluators know, and but be prepared to do all of the skills. Now, that being said, okay, so now that I've got all of that out of the way, during the test is set up to prevent injury. So when you're transferring a patient from bed to wheelchair, the care plan actually says the patient can stand. They just can't take steps. So they can bear weight. So you're not lifting their whole body weight up. The care plan says they can stand. So whoever's playing the patient, they're going to be told you can stand, you just can't take steps. So every effort is made during the test to prevent any potential injury from occurring during the test. So you're not actively lifting up the entire weight of a patient. When you're walking a patient, they're going to be told, don't fall, don't trip, don't do anything crazy. You're just walking a patient. You're showing proper body mechanics. You're not bearing their weight. So keep that in mind, that the test is structured to make it a little bit easier on you, but you still have to be able to perform to a certain extent for clinical settings as well. I hope that helps. All right, so let's see here. Taking the skills test online is valid. No, this is Jose's question. Taking the skills test online is valid. I do not know of any state that is doing an online only skills test. Now, there was a temporary CNA certification that was being used by, I think, 26 states during the height of the pandemic when testing was not being performed. And that was simply an 8-hour class that you could take online that would give you a temporary certification and allow you to work in nursing homes under the supervision of a nurse. That expired December 31st. So as far as I'm aware, no one is accepting that temporary nurse aid any longer. And that was for a very limited amount of time just to meet the needs of the patients in that time frame. Okay. So no, as far as I'm aware, now there may be a situation I'm not aware of, but as far as I'm aware, all clinical skills are still being performed in person in front of a state-approved evaluator in order to obtain certification. Okay. Thank you, Antonia. That's so sweet. Carolina, hello. Fred says we are short staffing. Yeah, Fred, everyone is. Absolutely. Guys, make sure you're recruiting. Tell your friends, your neighbors, your family members, hey, come be a CNA. Tell them how wonderful it is. Don't tell them how horrible it is. Tell them how wonderful it is, because we're not going to get out of the short staffing situation until we start bringing people in and getting them trained to help us out. If we go home and we tell everybody just how horrible our job is, and no one ever helps us, and the nurses are all mean, and this and that, we're never going to recruit people into the industry. And how in the world are we going to get out of this if we don't have more people to help? So make sure you're being good, nice about how you represent your industry to others. Okay, so let's see here. Peace is preparing. Let's see here, from Orlando. Thank you. And Blue says you might be able to get away with taking the written test online depending on the state, but the skills test is in person. Yes. So Beauty by Nicole is asking what the difference between HHA and CNA is. And unfortunately, right now we're out of time, so I can't answer that. But if you go onto my website under animated videos and click on healthcare settings, I have a whole video on that will help you understand the different types of workplaces and work credentials that you might see. And Nikita says, hi, Miss Patty and everyone. Failed the CNA skills. Main thing I had trouble with was radial pulse. Plus the clock on the wall seemed like it was going to fall off the wall because it was ticking so loud. I'm so sorry to hear that, Nikita. You're going to retest next week. So, Nikita, I do apologize. We're out of time, so I really can't help you too much on this, but go watch my videos on radial pulse on my website, and it will help explain all of that to you, okay? Thank you, Ramses. You're so sweet. Well, I hope you guys have a fantastic week, and apologize, but I got to run. I will see you next Thursday at 3, and bring more questions. I'm always here to answer them. And next week, we're actually going to do a deep dive into one of the written test questions so I can explain to you the thought process behind it, and explain to you why certain answers present certain ways. Okay, so we're going to kind of do a deep dive into how test questions are constructed. So that'll be a neat one for next week, okay? And thank you guys. You're so sweet. I will see you until next time. Make sure you have a fantastic weekend. Go do something fun. We need more fun in our lives. Go do something fun. So until next time, guys. Oh, wait. I can't leave yet. Hold on. We got to congratulate some people. So these are the people that dropped by my channel this week and told me that they passed the state exam. So here we go. Kenya, congratulations. D'Amica Williams, congratulations and welcome to healthcare. Joyce McPherson passed the written. Dropped by to let us know she passed the written. She was waiting to take the skills, and then we didn't hear anything, and that was 2 days ago. So if you know Joyce, tell her to drop by and let us know how she did so we can congratulate. And Christina Sky also passed the CNA state exam. So we're super excited for all of you. We wish you all the best in your new healthcare career. And until next week, guys, happy caregiving. Bye.